Hi everybody, I wanted to give you another update on the Balseskin ejection case. As you know, Fingal Communities Against Racism have been supporting an asylum seeker who was left out overnight in the cold at Balseskin last Wednesday night. We received a call on Thursday asking for our help, and we secured some mental health support for the man in question and tried to help him to arrange new accommodation and to get him through the crisis that he was clearly going through when we arrived. The case raised so many questions. We're really grateful to Louisa Riley for raising it in the Dáil on Thursday night, and to Catherine Murphy's office and to Duncan Smith's office for chasing it on Friday and Saturday. There are lots of questions raised by this case. Why was he ejected in the manner that he was when he was clearly undergoing a crisis? Was there any vulnerability assessment undertaken at the point that he refused to leave the accommodation? Why were his bags put outside of the accommodation? Why were his friends told not to retrieve the bags overnight? What responsibility did Balseskin bear for the loss of the bags, which includes very important travel documents, PPS number, a copy of the asylum claim, other certificates that the man needs for his asylum claim? This is a man who's been through a huge amount of trauma in his young life. He's clearly experiencing a new period of trauma. We know that some of that was prompted by short notice to move to another direct provision centre. We were happy to help step in and provide some on the ground support and solidarity and warmth at a time when he needed that. And we're pleased to say that we were able to do that. That meant that we sought immediate mental health help for him. We called an ambulance, and when he was released, we persuaded the hospital to keep him overnight so that he would be safe and not to have to access unsafe accommodation overnight or be on the street. And then we took him directly to his new centre on Friday. It turned out that that was an isolation centre rather than a direct provision centre, and he would be isolating for 2 weeks. For somebody in the middle of a mental health crisis, that's extraordinarily dangerous. We had left the hospital with a letter from a medical professional advising that he be under constant surveillance. The words weren't used directly, but it was effectively put him on suicide watch. The isolation centre he was sent to did not have the facilities to do that. The staff there were enormously kind and supportive when we explained the situation. We're very grateful to them for their humanity in the middle of this crisis. At the point we realised on Friday night that the reason he'd been isolated was because Balseskin had refused to mark him as present on the site on Wednesday night, and therefore he became eligible for quarantine. We contacted our local TDs. We're delighted that Duncan Smith took up that case with Minister Roderick O'Gorman over the weekend. And we're grateful to the senior IPAS officials who worked on Saturday to make sure that he was offered another place. And I'm happy to say now that for this particular individual, he has been taken out of isolation and sent to a new direct provision centre close to someone he knows where he can get support. And we've made sure that all of the relevant professionals supporting him have been informed of his location and his needs as far as we can ascertain them. And we will continue to support him at a distance over the coming weeks. He's just one individual. We were lucky to get a phone call about him. He was in our area, but we understand both from Mazzy and from the Irish Refugee Council that this is not an isolated incident. There are so many questions to be answered, in particular about the role of the Gardai in evicting somebody in such a state from a direct provision centre onto a public street. With no possessions, and certainly that's an issue that we'll be raising around Garda involvement at direct provision centres. It's not the first case of this kind, and we're sure it won't be the last. We know that the Irish Refugee Council said yesterday they're dealing with more than 150 individuals who are homeless, presumably have dropped out of the system in similar manners. We know that the mode of transfer, putting people in a taxi and sending them to another centre, raises issues there in terms of the transfer of information. And that's concerning to us, which is why we, of course, took this particular man ourselves to the isolation centre. And we know that these kinds of questions about care of people who are experiencing trauma in an entirely predictable system that they might have traumatized people in, just prompts questions about whether the system is fit for purpose at all. Doris Lumley today released a report on mental health supports in direct provision. It's clear that they fall far below the standard that should be provided for the basic needs of people in this system. Ireland is not meeting its obligations in this regard. Our system is not fit for purpose. It does not treat human beings as human beings. And while we're very glad that there's been some resolution to this case, and thank you to Abolish Direct Provision for bringing it to our attention in the first place, we really want to emphasise to everybody this is just one example of a systematic issue of a lack of care and lack of understanding of people experiencing trauma. And we hope that it will be taken seriously and not put to bed with this single case. But to everybody who's shown their support so far, for everybody who continues to search for this man's bags containing his important documents in the area of Balseskin, please keep up the good work. Please stay in touch with us and please continue to help us to highlight the situation of people experiencing trauma and how they're treated by the Direct Provision Centre. Thank you. Good night.